My name is Ngozika Orjioke, and by way of an introduction, I'm a physician, a doctor that works at the Lung Centers of Georgia in Atlanta, Georgia, in the US. I am board certified in internal medicine, pulmonary diseases, and critical care medicine. So I see patients in the outpatient office. I see patients in Atlanta Medical Center where I admit them onto the general medical floors. And I also take care of them as a consultant and primary admitting in the intensive care unit. I see medical ICU patients, I see patients post-cardiothoracic surgery, trauma patients, neurosurgical patients, neurocritical care ICU. I am also faculty on the internal medicine residency program at Atlanta Medical Center, where I teach medical students and doctors in training with respect to residency in family practice and internal medicine in the ICU. They round with me, they rotate with me on a monthly basis, and also some of them do come out into the office and do pulmonary electives with me. I trained at the College of Medical Sciences in the University of Calabar, and post-training I did an internship at the Eco Hospitals in Ikeja, Lagos. After my internship, I worked at Lagoon Hospital and Eco Hospital as a medical officer. At that time, I had an opportunity to be able to go to Australia, where I worked in Shepparton at the Goulburn Valley Health. I was there as an emergency room doctor, and I also did consults and rotations in the intensive care unit at Shepparton. At that point in time, it was obviously clear to me I needed postgraduate training, and so I pursued a residency in internal medicine in Chicago, St. Joseph's Hospital. I stayed on for 1 year as chief resident, actively involved in recruitments and interviews of new doctors coming in for residency. I got involved in teaching. I also got involved in going through the National Resident Matching Program. After that, I went to Keck School of Medicine, University of Southern California, and the Los Angeles County Hospital, where I did my fellowship in pulmonary diseases and critical care medicine. Again, I served as chief fellow during that training, and post-training I got a job here at Atlanta, and I currently am in Atlanta practicing medicine as a pulmonologist and an intensivist. For this particular event that we're putting together for students, doctors, parents who are interested in gathering enough information as to how to pursue a medical residency in the United States of America, the question that I'm asked is, why do we even need such an event? I truly believe that success has to be intentional. If you want to do something and you want to succeed in it and reach your goals, reach your destiny, fulfill purpose, you have to have information to be able to do that. For anyone coming outside of the US and wanting to succeed as a physician in the US, you need to understand how the healthcare system works here. You need to understand the tools you need to make yourself competitive when you're applying for residency programs. The amount and the volume of information that is out there with respect to internal medicine, residency, family practice, trauma, OBGYN, whatever the residency program in the United States is, there is a gamut of information out there, and then being able to sift through that information and decide what is relevant to your application is very difficult. It's very time consuming. And so my team and I have actually gone through that information, we've sifted through it, and we've come up with a template and a package that helps each individual doctor, each individual medical student decide what is absolutely necessary for them. I really do hope you'll join us for the seminar. And at that point, we will be able to take specific questions that are peculiar to you, because no two applications and no two candidates are the same. And we'll also be able to help you network and help you set timelines and goals